Now let's move to the periocular region, and I'm going to start off with the under eye. So, little scratch. Well done. Thank you. So I'll show you the technique for tear trough. So we move into the subcutaneous depth. Okay, we could possibly treat in the subcutaneous depth, but I'm going to be deep this time. I'm going to move just behind the muscle. You feel a little pop here, and we're now behind the orbicularis oculi. Advancing, and you see this depth. That looks like it's subcutaneous, but it's actually underneath the muscle. And we're going to do little micro droplets of filler, being really careful not to treat this nasojugal groove. This is what will cause the appearance of an unnatural under eye. If we add volume to this groove, thinking that it's where the tear trough is, we have to be above. This groove is the floor of this treatment.
We see this a lot where it's very tempting to overfill so it looks absolutely perfect on the day.
Yes.
And then two weeks later, once that hydroscopic hyaluronic acid has drawn all that water towards it, it then starts to look a little bit puffy.
Exactly. So we kind of aim for an 80% correction on the day. Now, when I look at this medially, I don't think there's any more volume to replace medially. And I think it's tempting to overfill it, but I love this transition here from the cheek to the lid. So I'm actually going to focus more on the palpebromalar groove. And this entry point is overlying the zygomatic arch. And again, we just have to move through the dermis. Okay. Pass through the skin, and then pop through the orbicularis oculi. And now we're gliding in this interlaminar fat that exists between the lamina of the orbicularis retaining ligament. And I can create a very nice transition from the medial to the lateral under eye. Again, using micro droplets of hyaluronic acid. From here, we can also fan into the lateral aspect of the orbicularis oculi as well, underneath it.
There was this idea that you used to have to scrape along the bone and get as deep as possible with these treatments, but actually just popping underneath the muscle is the perfect layer.
I think so as well. Yeah. So, really happy with that. I'm going to do the supraorbital treatment as well before we take a look in the camera. So, this one is reducing the height of the shadow above the eye. And I'm particularly interested, I'm not interested in treating the tail of the brow, which has got beautiful support, very prominent lateral aspects of the supraorbital bone. It's the volume underneath the orbit. And to do that, we have to be very careful. Okay, so open your eyes for it. If you look upwards, you can see the depth of the shadow. So how can we reduce the height? We're going to make an entry point along the bone. This one can be a bit of a sharp one. Okay, great. And we're touching down onto bone there. Well done. Now, it would be really helpful if you could open your eye for me. Going through the skin. We need to also move through the orbicularis muscle again. There. And now, very carefully, we're going to lower the height of the shadow. This anatomical target is something called the preseptal plane, which is connective tissue just anterior to the orbital septum.
In terms of aging changes, you've also got deeper changes still into the bones. So typically the orbit, you get resorption in both an inferolateral and also where we're treating now this supraorbital area, which can enhance that so-called A-frame alongside the changes in the fat pads as well.
So if I lift the tissue up like this, you can see where the gel is sitting, and I can help to create a nice even result here. That gel is projecting downwards and reducing the hollowness above the orbit, where there's been some volume loss over the deep fat behind the muscle. This way. Look up. Okay. Can I have the cannula, please? I'm going to continue this treatment. I have to go down the lateral aspect as well, the little scratch. Touching onto bone there. Good. Just helping to blend that transition. All right, towards me. Perfect. Touch more, then we're done, okay? Look up.
And because of the vessels in this area, it's definitely somewhere you'd want to be using a cannula rather than a needle. You've got both the supraorbital and supratrochlear foramen or notch in this area.
Yeah. Good. Right, let's take a look and see where we've got to with the treatment plan. If you sit forwards for us, please. Perfect. Straight into the camera for me. Okay, so I hope you can appreciate here what we have on the patient's right side, the patient's left side, is we've restored some of the deep volume in the deep medial and the deep lateral cheek fat, also the transition from the eyelid to the cheek. The tear trough appears higher up. And we've also slightly lowered the position of the deep shadow above the orbit on this side, all in all creating a more rejuvenated side to the face. And give us a really big smile, please, without creating these appearances of overfilling. And relax. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics.
If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
So we've decided we're going to treat the piriform fossa for two reasons. First of all, we think it will improve the volume of the medial cheek and help with the transition across the nasolabial fold. The other thing is that it will slightly elevate the upper lip, which I think is important in the lower third of this face, where I feel we've got a slightly elongated upper lip. So I'm going to talk about the injection technique for the deep piriform space with a cannula. And so let's make our entry point at the intersection between this subnasal line and the lateral canthus. So this is how we find our entry point. And I'm going to use a deep projecting filler Revenus shape. And we'll talk about the layers that we have to go through. So first of all, we move through the skin. We're in the subcutaneous fat. Next, we have to move through the SMAS. The SMAS is going to give some tension like this. Okay, and we have to pop. And we're looking at a deep angle, a 60-degree angle here, as we push through the SMAS. With a 22 gauge cannula, it can feel quite like you need a lot of pressure because it's more blunt. But we are using a 22 gauge to improve control of depth and safety. Okay. If it doesn't go through easily, we can use a twisting motion. There. Okay, so I'm through the SMAS of the midface. There is, however, another muscle we have to move past, which is the LLS muscle. This one sits on top of the deep medial cheek fat, and we'll navigate that by keeping a deep angle as we progress through the medial cheek. Once we are behind the LLS muscle, there. Now we're gliding very smoothly, and this will be probably the deep medial cheek fat that I'm in. If I progress even further, I find a bony target. That's my deep piriform space. And here, I'm going to be injecting whilst moving a little bit.
There's branches of the infraorbital nerve that run through here, so it can be a little bit uncomfortable, and you have that slight nervy pain. You'll often see your patient flinch a little bit when you're in the right space, but that local anaesthetic quickly makes it feel more comfortable. But worth warning your patients afterwards that if their top lip feels a bit numb afterwards, that's completely normal and only tends to last 20-30 minutes or so. We also know from our ultrasound examination beforehand that the facial artery is lying more superficially in this area and actually more lateral. So that doesn't mean that there's no vascular risk here, but it's significantly lower.
Great, almost done here, Emily. You're doing great. Done. Fantastic. And I always like to feel here, I can feel a deep nodule of hyaluronic acid right in the deep piriform space. And we can definitely massage this like that if we want to encourage a bit more of a smooth result. Okay, this I think really completes the medial cheek. So let's take a look at how that looks. It's flatter. Yeah. There's less contours of the light and the shadow now.
Yeah.
Everything feels like it's positioned in the most natural possible way.
I'd even say the corner of the mouth on that left-hand side is just being pulled up a little bit more compared to the right-hand side, or certainly the lateral part of the upper lip.
Okay, the final thing we want to do, just to really balance the aesthetic in this result, is we want to try and increase the height of the lip. And in doing so, I think we will rejuvenate the peri-oral zone. We can also treat some of these vertical peri-oral lines. What we're trying to avoid is too much projection and overfilling of these lips. A very natural shape to the lips, and the patient has very kind of slight, delicate features. And so a significant volume in the lips won't look appropriate, but we can start to target some of these age-related changes. And so to do that, we're going to do a little bit of vertical height with a tenting technique in the lip, and we're also going to try and reduce the dermal creases with some hyaluronic acid as well. So now let's look at a vertical tenting technique for the lip. We're going to start off at the GK point, trying to create as much height as we can at the Cupid's bow, okay? So chin up for me, thank you. We're just going to, with the bevel facing upwards or forwards, we're going to track down like this. That's the depth you want to be, okay? So just underneath the skin. And that would be one linear thread.
And this technique respects the compartments of the lip because we are staying within the compartment when we come in at this angle rather than traversing them and disrupting that fibrous tissue between them. Always staying within the white roll or vermilion border still.
Sometimes if the filler tracks superficially like this, we don't have to worry, we can massage it. And it will integrate into the tissue. We see on the day that this border becomes slightly inflamed, but it's not to be mistaken with treating the vermilion border itself. And I think that would be all we would do on this side. Mm-hmm. So let's take a look now, and we can see the vertical height that we can achieve from this approach, which is elevated the left lip. And you can see that in combination with the mid-face treatment sequence and the peri-orbital treatment sequence, we've got a really nice rejuvenation.
Hello, my name's Jo. I am a doctor with a background in anaesthetics. I now work full-time in aesthetics, and I'm using some transferable skills between my old career and my new career today. We've introduced ultrasound into the Academy Clinic. So I work as a trainer here at Harley Academy. I'm also head of medical services for the Academy Clinic. I'm here today helping Tristan out.
Perfect, thanks Jo. Let's take a look at the scans now. So if you remember, we've been looking at, particularly with this case, focusing on ensuring that the filler ends up in the target that we intend so that we avoid these mid-facial overfilling risks.
Let's start a bit more laterally. So we've got that nice bright white hyperechoic line of our zygoma. And then we're heading into the maxilla here in the mid-face. So we've got some superficial subcutaneous tissue here. with some little interfascial lamina that you can see in the fat. As we move a little more medial, I'm going to change from an axial probe in a second to longitudinal, but you can see we've got some deep filler deposits, those hypoechoic spherical filler deposits to the left of the screen.
So that would be the apex of the cheek injection?
Those are our cheek apex injections.
Can you see if it's on bone?
Yeah, it's just above the hyperechoic structure of the maxilla. And then if we rotate our plane, so we are now longitudinal, we are going to be looking down, sorry, let's get a little bit more jelly. So we're looking down, the little black bit at the top left of the screen is the inferior portion of the orbicularis oculi. And then as we move a little more inferior, we have our LL-SAM, which is another thick black muscular structure, and a branch of one of the other lip elevators. Let me just get a better image. Just branching off above it, and you can see underneath that medial muscle, we've got hypoechoic hyaluronic acid filler deposits. Some pre-existing, so the one a little bit more inferior is the pre-existing filler, and the one just above that to the left of the screen is our newly placed filler, down just above the bone that you can see. That's the bright white line.
So can we get a shot of just the best shot of the black filler and the white line of the bone? I think that's what we need to, I really want to see that.
Mm-hmm. Sorry, Emma.
That was good.
Yeah, that was good. There's a slight lag on it because it's running out of battery.
Should I increase the depth slightly?
Sorry? Yeah.
There we go, good. That's what we want to see. So one of the things we're learning about injectables is that where we thought we were injecting is not often where the filler ends up. And there's various things we can do when we're injecting to make sure that the filler ends up in the place we intend. And this case has been really important in showing previously where filler has been injected badly, dissolving that filler, and then choosing specific targets and noticing that you don't need an ultrasound scan to actually make sure you're in those correct targets during injection, but the scan is helpful to show and confirm that we're in the right place. So in this case, for example, demonstrating that we are injecting down onto the maxillary bone when we're treating the deep medial cheek fat or the piriform space. And because they sit beneath the muscles of facial expression and the elevators of the lip, when the patient smiles, we don't get this bulging projection, and that's crucial for understanding how to create natural results for our patients.
What we learned in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
So after we've created this vertical height in the left upper lip, which I think if you just look into the camera for us and head off, you can really start to see the improved height. If you blow a kiss for us, we still have these vertical lines. And the reason we have those lines is because the dermis is actually very attached to the underlying muscle in this part of the face. So I'm going to use a cannula and I'm going to disconnect the dermis from the muscle, and in the process add a very thin sheet of hyaluronic acid, which should reduce the peri-oral lines. So making my entry point. Well done. Okay. this can just create some inflammation and swelling in the upper lip post-treatment. So your patient may worry that they've had a bit of filler beyond the lip border, and you just have to reassure them that this is just temporary swelling. But as I'm pushing through, I can feel the little attachments, and the objective here is, before injecting, to subsize and disconnect the dermis from the orbicularis oris muscle. Can be a little bit sore, so I'm going to inject a little bit now with product. I'm using Reviness Revise here, which is the softest product, still a cross-linked gel, to try and reduce the discomfort and also create a bit of space.
And you can liken this to like a blunt dissection, can't you? And then a bit of hydrodissection when you're advancing with some product.
So now there's some gel in there. It's more comfortable. I'm going to just be a bit more fast with my dissection. Okay, so one last treatment I'm going to do before we review the entire treatment sequence is I'm going to add a little bit of volume in the posterior aspect. And I notice here that there's a little bit of skin laxity and there's a very small amount of subcutaneous projection and tissue. I've previously treated the preauricular area, but in order to really get the best benefit along the jawline, I'm going to treat the mandibular angle in the subcutaneous depth. And ordinarily this would have been something I did at the start of the treatment sequence, but I've just noticed that this is something that's going to enhance the results at the end of the treatment sequence. So if you can rest your head back for me, turn all the way this way. And so this one is a relatively straightforward injection. We have to follow the same precautionary principles that we have when we're treating the preauricular area in general, which is that we want to be in layer 2. And we want to stay in layer 2. Okay. So with this, we can start to sculpt the posterior aspect of the jawline. A little bit of resistance here as we move through different fibrous septa in the tissue, but that's our subcutaneous depth that we want to treat into. Conscious here that I'm using a highly projecting filler, so I don't want to inject too close to the dermis, and it's really important to understand that you can be in layer 2 scraping the underside of the dermis, and you can be in layer 2 deeper in the subcutaneous fat. And when you're using a really high projecting gel, you want to avoid being that close to the dermis because you can create tracks under the skin that actually don't disappear on massage. And when the patient opens their jaw, you don't want to create tracks just within the skin. And so I'm going to be in the midpoint of layer 2 when I'm injecting in this area.
The structures we're thinking about here, we've got the masseter muscle, parotid gland a little more superiorly, cranially, and then we've got our facial artery emerging deep.
Yes.
Very broad of the masseter muscle.
So would we say this one is a relatively low risk injection?
If you're in the right depth, yes.
Yes. And that's why this would be regarded as a development stage 1 technique. So it's suitable for beginner injectors. That's it. And we just got to give it a firm, if you bite your teeth together, we can just massage down against the muscle. Okay, perfect. So now let's take one last review. If you look into the camera for us. So if you remember, this is Emily, and we have started off by dissolving filler that was in the wrong depth. And then we did a treatment sequence today that started with the cheek apex and the lateral zygoma and treating the preauricular and this kind of subzygomatic region as well. You can see this beautiful definition along the cheekbone, giving it this kind of feminine, natural contour along the cheekbone itself. Then we moved to the medial cheek, being really careful to inject beneath the lip elevators with a needle, treating the deep medial and the deep lateral cheek fat, and then transitioning to the peri-ocular region, treating the tear trough itself, and then the palpebromalar groove, and then supraorbital, treating the A-frame to lower the depth of the shadow above the eye. Then we did an additional Piriform fossa treatment because we noted that actually this was something that could directly improve the upper lip by elevating the upper lip slightly. And that also really nicely improved the transitions and the shadows through the medial cheek. I've treated just this side of the lip, and so you can see the height of this lip using a tenting technique. And if you blow a kiss now for us, hopefully you can see a reduction in the peri-oral lines as well, as we've used some product and a cannula to dissect those attachments. Just blow a kiss again. I think that's a very nice example of that. Generally, you can see, because we've volumized here, there's a lot more stability to the muscles. If you smile for us, really big smile. We don't have any symptoms of overfilling because we're injecting beneath the lip elevators. Final injection, if you relax, was to create some support and structure in the lateral aspects of the jawline, which I hope you can appreciate is now a higher and more rejuvenated jawline on this side. So in total, a multi-mil treatment. I'm going to do the full treatment now on this side, and then we'll take a look at the final results on camera. Okay, so this is Emily after the full face treatment plan, the lateral and medial midface around the eyes and around the mouth. We've shown on the scan that we have replaced the filler which was previously in the wrong depth, which is now in the correct depth. And this is immediately after treatment, so there's going to be a little bit of swelling, particularly around the mouth. Okay, let's do some expressions. So look into the camera for us, okay? And now, can you smile? Okay, and relax. Turn this way, and smile, and relax. So that's a really important angle to appreciate the change in the volume in the midface when the treatments are in the right depth. The thing that I'm noticing the most is the transitions here from the lateral midface all the way through to the lips, and where we don't have these waves in lights and shadows, particularly the deep support in the anterior midface is what's giving that very rejuvenated appearance. What we don't want to do is, the temptation is to create this volume that's so high up on the cheek to simulate what a very youthful, kind of almost early 20s type cheek appearance is, because we have to appreciate the difference between youth and beauty, and we can still retain beauty over the decades without trying to simulate what youth always is like. And with the combination of skin laxity and volume loss, we will naturally have these changes, and what we can do is reposition tissues in the most natural way. So this is the second part in the treatment plan. How do you feel, Emily?
I feel good. I feel great.
Good. Do you have a mirror? Let's do it. Emily wants to see you. Yeah, that's fine. Have a look in there and tell us what you notice.
It's great. It's really nice. It's really nice.
What's the thing you notice the most?
The kind of smooth line across here.
Mm-hmm.
Here.
Above the eye?
It's amazing.
Yeah, okay, great.
And certainly got rid of those horrible lines. I mean, I know that's going to go down, but that looks really smooth as well. It looks good. It looks good.
Good.
Yeah.
All right. So we're going to get you back in a few weeks for a final review.
Okay.
But thank you for today.
Thank you very much.
Thank you.
Thanks all of you.
Thank you.
Thank you.